So hello everyone, welcome to the Be Well Live series. My name is Dr. Melanie Carminati, and I am the founder of Inspira Physical Therapy and Pilates here in Park Slope in Carroll Gardens, Brooklyn. Inspira is a virtual team of doctors of physical therapy who are also Pilates practitioners. We specialize in advanced orthopedics, pelvic floor PT, Pilates rehabilitation, and so much more. So I am excited today to be chatting about fascia. And our guest is Tracie Matthews. So for those who don't know Tracie, she is the founder of Intuitive Motion Pilates, which was founded in 2003. As a master Pilates trainer, Tracie has advanced knowledge in working with clients in post-rehab and also pre- and postnatal moms. Tracie is especially skilled at nurturing first-time Pilates students and those recovering from injuries. Tracie loves incorporating movement and dance concepts into her Pilates work. She holds 2 certifications through Physical Mind Institute, which is a Pilates certification, and Dynamic Embodiment, which is a somatic movement education. Hey, Fu, we see you there. Tracie teaches somatic education and has comprehensive rehabilitation knowledge and experience. So Tracie, thank you so much for being here. For those who are viewing, some of you may already know, but Tracie is a dear colleague of mine, and we met when pre-COVID, when we were both working out of Ellie Herman and Pilates in Brooklyn. And Tracie would often see many of my patients who were either on their way towards discharge or who had been discharged themselves. And I have had the fortunate experience of working with Tracie. I've had many Pilates privates with her as my Pilates teacher. And she has this unique background of the somatic education that she fuses into her Pilates teaching. And this is particularly important when we're considering fascia and also considering somaticized pain as well as trauma. So I wanted, before we start talking, to remind the viewers that there is a giveaway prize. If you are one of the last 5 viewers to give us a thumbs up in the comments section, you will get a virtual Pilates class at Intuitive Motion and Pilates. So if you give a thumbs up in the hey Blossom, hey, if you're one of the last 5 to give a thumbs up in the comment section, you will get a Pilates class with Tracie. We've already given out the first 5 for Inspira because we did that in the story. But let's get to the chat. So, fascia.
Fascia. It's a
Fascia.
very big topic.
So, yeah, what is fascia and when did it become a thing?
So fascia has always been a thing. It's just people didn't address it. It is connective tissue. It is, and it has a fluid base. Interstitium is also part of the fascia fluid aspect of the tissue. So it's kind of complicated in the science because we learn things first through cadaver, dissection of the body. So they used to take the fascia out, put it to the side, and learn about the organs and other things in the body. And then years later, they said, hey, what's that stuff we've been putting to the side? And let's go check it out. And when you look at fascia and a person that's already passed on, it's very different than looking at live tissue when a surgeon's looking at it in a surgery. So more recently now, that's why they came up with interstitium, because it's part of the fascia, because it's a fluid. And especially once you embalm a body, it's no longer there. You can't see that aspect of the fascia. So it's an interesting part of it. So it's connective tissue, and it creates some support, stability, and mobility in the body. And we really can't move without it, and we also really can't feel light against gravity without it. It is what helps us to feel light. So that's why sometimes you have someone who's really thin and small, and they walk really heavy because they're not connected into their fascia. You can have someone who's really big and overweight, and they look like Jackie Gleason. You guys who are young know who he is. Look up The Honeymooners. He was this really big guy who the Flintstones commercial cartoon was based on, and he moved like a ballerina because he was really connected into that part of his body, and it created a lightness in his movement. So I mean, there's just so much to talk about it. It supports. It's what we mostly know about it is the fascia directly under our skin. So if you kind of press gently onto your arm and soften your fingers and let them sink in, and then you tug towards away from your fingers, you'll feel a pulling all the way from your fingertips up. And if you tug the other way, you'll feel a pulling from your elbow down. If you don't feel it, you're probably pressing too hard or too deep, or if you're pressing too superficial where you're on the skin. And like that's skin, and that's fascia. And it has a very specific feeling. And that's superficial fascia, that's right under the skin, but it also transverses, it goes through everything. So it covers and it goes through, and it becomes a pulley system in the body. So it does a lot all day long.
So if I may share my experience as a PT, fascia, like you're saying, everything you're saying is what it is. But from doing myofascial release with patients and having my hands on people when I'm working, the layers of fascia is something so fascinating to feel underneath your hands. That superficial layer, you have to have very sensitive, intuitive hands to pick up on the restrictions in that way. And then now, when I get into the visceral fascia, which, like you said, fascia covers everything. It covers neurovascular bundles, muscle groups. It compartmentalizes the muscle groups. It's also covering your organs. So it's covering us from head to toe on the inside. When I do my visceral manipulation, that is something that's fascinating to feel. If I'm mobilizing a certain organ and I can feel a pull, say I'm mobilizing someone's bladder, and I feel a pull up to their left lung, that is something that's really fascinating because of that. And I know you, and I know how intuitive you are in your own body with knowing the connections. So it's really, it's an amazing thing once you get into it as a practitioner, as a physical therapist, and then as a movement practitioner when you're diving into fascia with that.
Yes. And also people don't realize there's fascia covering the bones, right? Like you just think of the bones as the bones, and then there's fascia going through the bones. And, you know, so it is around and in through everything. And it's just like, you know, kind of this whole new world that people have started connecting to. Part of your question was did it become a thing? And it became a thing really, well, in different aspects. There's aspects in surgery in like 1911, I think, in the US, they started keyhole surgeries, which kind of uses the fascia layers with meridian lines so that they could start doing surgeries that were less invasive. And it took like years, like 70 years before they got really good at it. And now, instead of getting this giant appendix scar, you may have 1 or 2 or 3 holes, depending on what they need to do. And that's because they're using the pattern in the fascia to access the body where it's going to heal the easiest. It's going to be the best possible outcome for the patient and for the surgeon. And they have the tools now, too, because everything modernizes and changes. And tools are smaller and more sophisticated, and things keep changing. And then it also became a thing, I believe, in the 40s. I'm not sure if I'm correct on the dates, with Rolfing and the Barnes method. And you know more about the Barnes, and I know a little more about Rolfing. And then anatomy change, which was started by Tom Myers after he trained with Ida Rolf, which are all great things, and they all have wonderful information about fascia and how to massage it or release it or connect to it. And all the different approaches have benefit, and I think there's lots of options out there because some things connect to one person and other things connect to another.
So how would you say that the fascia communicates?
It communicates like a nervous system. It does have nerves. I think the Hopkins Institute said that there are nerves, and it works similar to the peripheral nervous system in the skin. And some people believe that it works like a flash, whereas if we have a cut or a sharp pain from fire, we know that instantly, but they've tracked the speed of the central nervous system, the peripheral nervous system, and it's not fast enough to get that information that we already are experiencing. So they believe that's happening in the fluid base, in the interstitium of the fascia. That information gets processed immediately. There's no delay. It's just instant. And it communicates through the fluids.
So from my background in Polestar and having had the opportunity to work with Carol Davis down in Miami, at Polestar, and Carol speaks on this too and has presented on this about energy medicine and the fact that the cells in us, everything's vibrating, so that the energy exchange that's happening, I always think of that as how the communication happens. You know, it's chemical, it's mechanical, it's neurogenic, it's multi faceted as to how the fascia communicates. So with that breadth of how it communicates, how would you say fascial restrictions impair movement?
They restrict.
For example, like headaches is an example that's really common, right?
Headaches are a really common thing. What I was initially thinking of is that fascia is one of those tissues in the body that changes on impact. So it contracts on impact, but it's instantaneous. But if you have a trauma and you have an impact and then it doesn't release, right, that creates changes in the body and how you move, how you act in pain. So that's one thing. Headaches are a really common thing that I see in my practice. When someone comes in, the first thing I ask them when they say they have a headache is, where is it? And if it's in your forehead or behind your eyes, I immediately work on their feet, getting some kind of footwork going, some kind of release on the Wakers or Franklin balls to open them up. And then they'll be shocked that in like 10, 15 minutes, if it's just a superficial fascia pulling, the headache will go away and it won't come back. And if you learn how to do that for yourself, eventually, if that's the headache that you have all the time, you can actually get rid of it. And migraines are a whole different ball game. That those are much more complicated. But you know, the headaches right here and here are check out your feet. Give yourself a foot massage while you're staying at home.
Yeah, something simple and easy. The other diagnoses that I know as a PT, how they'll impair movement, for example, in the thoracolumbar fascia, which is that huge accumulation. It's like that big diamond in your thoracic through lumbar all the way down to the sacrum and coccyx. If that thoracolumbar fascia is tight, you know, we can see that when we're watching people move, when we're having them bend forward. If I'm doing a movement assessment, or if you and I are guiding them through a Pilates specific mobility exercise, if it's bridging with articulation or whatever it is, you can see that where the restriction's coming from. Plantar fasciitis is another example. And then contrary to tightness, we have excessive laxity, which would be diastasis recti and the linea alba. So those are like all things that are bouncing around in my mind as a PT when it comes to fascia and fascial involvement. But you mentioned, you said trauma, and I want to go on with that about what causes these fascial restrictions. Trauma, injury, surgery, right? Scar tissue. What else can cause the fascial restrictions?
I mean, that you just listed them.
I listed them all. Okay. I was just, did I miss any?
I think I'm a little nervous.
Oh,
being on camera, I get a little stage fright, so please forgive me. But yeah, so trauma, definitely injury, impact, gets your fascial restrictions, and stress, anxiety.
Yes.
Being in the world that we're in right now, there's a lot of stress going on. And one of the things that I am recommending for people to utilize to help alleviate stress and anxiety is imagery. And just thinking about their fascia is supple and smooth. And,
you're getting a thumbs up. You are fantastic. You're doing great. Yes, she is. Thank you, team.
Yes, I am a little nervous. first Instagram live, so this is a new space for me.
Yes.
So yeah, so everything is just kind of affected by our thoughts. We don't really give our minds enough respect on how much power they have over the body. So if you are having stress, and I don't know how you could not be currently, mindfulness is becoming more popular, and doing whatever that is for you. My kind of mindfulness is baking or sewing. That's why if you look at my Instagram feed, it's mostly food. It's not a lot of Pilates, because that's how I de-stress. So everybody has their way of meditating, and it doesn't have to be just sitting and doing an actual hardcore meditation practice the way you imagine it in the media. So there's lots of choices, and there's lots of things to do. And yes, so we talked about trauma. We talked about inflammation. Oh, did we talk about inflammation?
Well, I was going to say that chronic stress causes inflammation in our bodies, right? So that could be a form of inflammation, and then it could be, acute.
Yes. So inflammation is one of those things that, everyone deals with, and it does have a really strong connection to fluids and just allowing yourself to yield. And again, concentrate on imagery will help with that. And also doing movement, just getting up and walk. One of the things that I've been working with a lot of my clients during COVID, staying at home, is doing laps around your home. Right? So whatever your space is, find ways to do laps and time them to your normal day. So if you used to walk to the subway or the car at 8 a.m., it took you 10 minutes or 15 minutes, walk around the block, walk around your home for 10 or 15 minutes at 8 a.m., at 5 p.m. or 7 p.m., whatever your normal walking routine was, your body will be like, oh yeah, this is what we do. This is and it will feel better if it's not feeling well during this time of being so confined. Those are great things to have, that timing of walking around at the normal times that you did before we were staying at home all the time.
I want to tag along with what you were saying about thoughts and our mindfulness and the dialogue going on in our brain, whether conscious or unconscious. Dr. Lorimer Moseley and his colleague, who they wrote the Explain Pain book, they explain that thoughts are still nerve impulses. So, and David Butler, that was his colleague, they explain that those thoughts, they have that neurogenic effect, and the exchange and release of chemicals and all of that directly impacts our biochemistry, and then therefore impacts our fascia. So with all of these fascial restrictions and ways that fascia can get restricted that we mentioned, how can movement improve fascia mobility? How can we help besides just walking? Are there other tips and recommendations that you have for people to help keep their fascial system healthy during this time?
Well, definitely water. The body just needs a lot of water. And stretching, reaching, changing levels, moving through space, so you're not just sitting and standing. You pick things up from the floor, reach up above your head. All those kinds of everyday movements, but you can make them into an exercise protocol where you're reaching and changing level, going from the floor up to mid, up to standing, turning, rotating, kind of just trying to move the body through all the planes of movement. I learned a lot of that stuff from some of my training with in Laban movement analysis. That was part of my somatic training, where they really were interested in dynamic movement and moving in different levels. And that is really a wonderful thing to be doing as an average person, because if you're a dancer, you're already trained in that. You know how to do that intuitively. But as average people, we don't think about that. We don't think about oh, have I been on the floor today? Unless you have toddlers, like unless you have little ones, you know, like, you know, go on the floor as long as you don't have any injuries and it's not bad for you, and work your way up through different levels, and reaching will help your fascia, and bouncing. There's an exercise called jiggle that the fascia, like I said, it changes on impact. So doing like gentle, like cardio and bouncing, and you know, helps the fascia to stay supple. It also helps the synovial fluid in the joints, which is another fluid that kind of feeds on being, you know, utilized. And using your body, moving your body is the best thing, and just finding ways to do that you feel comfortable with.
Great. Okay, Tracie. Well, thanks so much. I feel like we encapsulated so much fascia information in a short period, but we could totally expand on this in the future. I want to thank everybody for viewing. If you were one of the last 5 people to give us a thumbs up in the comment section during this live, so if you're still here, you want to give us a thumbs up, you will get a complimentary virtual Pilates. Blades Mama gave us a thumbs up. You will get a complimentary. Eve gave us a thumbs up. Yes, keep it coming. Zena, yep, keep it coming, guys. The last 5 will get a complimentary virtual Pilates class with Tracie. Oh, Noel's in. Okay, at Intuitive Motion Pilates. So we will follow up with you afterwards. Foo. All right. Hey, we got a bunch. So the last 5. So Tracie, thank you so much. This was a really great chat. I had fun chatting with you. You did excellent also.
Thank you.
I just want to remind everyone that I am continuing the Be Well Live series tomorrow, 5:30 p.m. Follow Inspira Physical Therapy and Pilates YouTube channel. Subscribe to that. Or someone said, amazing, Tracie. Thanks so much. You're welcome, Eve. Or follow Inspira Physical Therapy and Pilates on our Facebook page. We will be streaming live there with Dr. Ben Taylor, and we're going to talk about osteopathic tips on how to stay healthy at home. Yes.
I've heard of him.
Tune in for this. Oh, yes. Yep, we are. Yes. Okay. So I'll see you guys tomorrow, 5:30 p.m. Tracie, thank you again.
Thank you, Melanie. This was awesome. And take care. Bye.
Bye.